All right, so back to the coronavirus. Taking you to South Africa, where the country is struggling through a devastating second wave of COVID-19 infections. There are now over 1.1 million reported cases in the region and close to 32,000 deaths, according to Johns Hopkins University, of course. And that makes it Africa's hardest hit country. Last month, South African scientists discovered a new variant of the virus. It is similar to the one found in Britain, but there are some key differences. So to talk more about how the country is handling the pandemic, I'd like to bring in Lesley Wroughton from Cape Town. She's a contributing writer to the Washington Post and has been following this story. Thank you so much for joining us. I have no idea what time it is in South Africa, but I know it's early here, so I appreciate it. So South Africa is really buckling down. They had put in place some really strong restrictions early on in the pandemic, and it looks like there are more restrictions now coming into place. Can you tell us what the country is doing to slow the spread of COVID-19?
So on December 28th, between Christmas and New Year, the president, Cyril Ramaphosa, came out and imposed some more restrictions or reimposed restrictions after the resurgence of this new variant, which is incredibly contagious. Don't forget that in March last year, South Africa was placed under the most stringent restrictions that there were in most countries, with a complete lockdown. Now, because of the economy struggling, they've adapted it, but one of the biggest things is that they have banned alcohol. They have made wearing masks compulsory, and also banned large gatherings. Between the festive seasons, most South Africans go down to the coast, and that was causing super spreader events. There were lots of parties and big gatherings. So the president came in and announced a further lockdown, which goes until January the 15th. It's unclear right now whether he will actually extend that or actually impose further restrictions.
Here in the U.S., the coronavirus has exacerbated long-standing inequalities in this country. People in the medical community have been sort of fighting disinformation throughout this entire time, not just when it comes to the virus, but also now the vaccines. I'm wondering what some of the unique challenges are in South Africa. Are you seeing some of the same hurdles that we are trying to tackle here in the U.S., and are there others?
Well, South Africa is one of the most unequal societies in the world. That has been found by the World Bank, and the coronavirus has definitely highlighted that issue. It is difficult for the poor who live in congested slums, let's put it that way, they're called townships, to do any social distancing or to isolate. There are many people in a single dwelling, so it's hard for anybody to separate from anyone who has coronavirus. So that has made it especially taxing for the country and especially for the poor. The poor also use mass transport, which is taxis, which is why the government has imposed the restriction of you have to wear a mask over your nose and your mouth. That's one way to try and curb this new variant, which, as I said, is particularly transmissible.
Yeah, about this new variant, it's more contagious. It looks like with sort of early research, though, that the number of the vaccines, at least one of the vaccines that it's being distributed now, will work, but still, before that happens, people have to not catch this. I'm wondering just, how is the healthcare system handling the virus? Is it a public healthcare system in South Africa, or is it a combination of public and private? How does it work there?
It is a combination of public and private. Obviously, the masses would go to the public healthcare, and then if you can afford it, you would go to the private one. But at this stage, all hospitals, private and public, are operating at capacity, given the resurgence of COVID. And again, the new variant is incredibly contagious. 1 in 3 people that are tested test positive. There are long lines of people outside testing centres. At the moment, there are shortages of beds in ICU and elsewhere, as compared to the first wave, where the government rolled out extra bed space. This time, they didn't do that. So both public and private sectors, hospitals are operating at capacity and are severely strained.
Just to clarify, Lesley, the vaccines that have been approved in the U.S., have any of them been approved in South Africa, and are they being distributed, if they have been?
Not yet. The government announced this week that they were going to import about 1.5 million doses of AstraZeneca, and that is mainly because it's cheaper. So it's the British vaccine. It's a lot cheaper than the American versions, and also you don't have to store it below freezing. AstraZeneca would be able to be transported. I mean, the South African system doesn't allow transport and storing of vaccines. The AstraZeneca would allow them to transport it at facilities that are available here. The American ones need to be below freezing, and that's impossible for the South African system.
Oh man, it's all very concerning. But Lesley Wroughton, thank you so much for joining me this morning.
You're welcome.